Hello everyone, welcome to Gravitas AI live series. Today we will be discussing about revolutionizing healthcare by harnessing tech and AI for better patient experiences. And today we have with us our co-founder of Gravitas AI, Mukesh sir, who is an accomplished leader and entrepreneur with nearly 3 decades of experience in healthcare and health tech ecosystem. A very warm welcome, sir. Thank you for joining us.
Thanks, Rosali, for hosting me.
Thank you, sir. So we will be starting with the Q&A session first. And so my first question to you is, how can healthcare providers effectively integrate technological advancements to enhance patient care?
Yeah, healthcare is a very sensitive and critical sector. So it is very much important that treatment of any patient is depend upon the three very critical and important factors that include right diagnostic, right treatment, and of course right flow of information. And right flow of information means it has to be right communication from the doctor to the patient, and patient have also the right to ask whatever the questions are there. So if all the three factors are coming together, then doctors or the hospital can expect the right outcome. So it is very much important the technology integration, so that all the parameters and data can be provided in advance. Based on that, doctors can evaluate the data and take the right decision. So integration of technology, I would say it's a very much integral part of modern healthcare.
Okay, that answers my question, sir. Thank you for your insights. So my second question to you is that with nearly about 3 decades of experience, sir, what emerging trends do you believe will have the greatest impact on the future of healthcare?
Healthcare is always very important for all the government, and irrespective of the status of the country. I mean, whether it is a developed country, developing country, and poor country, because health is the fundamental right of the citizens, right? So affordability and quality healthcare, that is the biggest challenge of in any organization or any government. And this can be achieved only through the technology integration, because that will ensure the healthcare cost to be affordable. And same time, it is the moment you integrated the technology, the process is much faster, so the cost also get reduced over a period of time. So affordability and quality of healthcare, that is the two key factor, and that can be achieved through the newer technology.
Thank you, sir. I truly believe that healthcare is the fundamental right of every citizen. So my next question to you is that how can Gravitas AI is offering support and improve the performance of the healthcare enterprises?
Yeah, Gravitas AI taken a lead, particularly in the providing the virtual assistant, right? The reason behind, because I have been in the healthcare for last 3 decades, the biggest challenge patients are facing is a gap between the hospitals and the patient, particularly in terms of communication gap, because number of patient is very high, doctors are limited, and they have limited time to take care about the consultancy, and in case of surgery, it is the surgery. So it, but same time, patients should also know, okay, what is what kind of treatment they are providing to the particular disease, what are the do and don'ts, what other factors are involved in terms of cost and other things. So we have been seeing that over a period of time, the trust factor between the hospitals and the patient has been reduced over a period of time, and one of the reason because of the communication gap. So T- Gravitas has introduced the Tina, that is the virtual assistant. So this gap can be bridged through the 24 into 7 effective communication. And this communication is also medically approved. So it is not a general information like it's taken from the Google, because it's a very sensitive. So information has to be approved, and it has to be customized as per the individual clinic and the hospitals. So Tina offer a customized information. It's a virtual assistant, or in other word, we can say chatbot. So that bridging the gap between patient and the hospital through 24 into 7 information provision. Top of that, it is a multilingual capability, so patient can access the information as per the convenience of their own languages, whether it is Hindi, English, or any other regional language, or even the global language. So Gravitas provide more than 80 languages that can be integrated through the TINA. And top of that, apart from information, it is also help in the trust building. So it's a very like information is provided which is already be approved by the hospital. So consistent informations are there, so that naturally that provide the trust building. So what is the trust deficit? It is being covered through the modern technology.
Indeed, sir, Tina can bridge the gap between the patients and the doctors. So the next question to you is that how can Tina assist in improving patient engagement, website visibility, appointment scheduling, and other healthcare related tasks?
See, so far, good infrastructure. Infrastructure means good hospitals, clinics, and skill staff is skill surgeon and consultant. That was the most important. But in modern healthcare system, you required uh, digital infrastructure also. Digital infrastructure means patient can access to your hospital 24 into 7. Uh, they can get the relevant information 24 into 7. So all these things are only possible through the technology integration. And of course, the TINA, which is the virtual assistant, which provide the qualified and approved information, whether it is information related to any particular disease, information related to uh, knowing the details about the individual doctors or surgeon, and of course, what are the things are involved, including the cost, and what are the do and don'ts. So all this information is being provided through this TINA. So that helping to the patient to get connectivities 24 into 7. And of course, it also helped to the service provider in terms of getting the right feedback. And these days, even Google feedback is very very important. So Tina provides such kind of platform that patient can go and provide their feedback. And apart from Google review and rating, even the feedback about the services, feedback about the individuals and other things. So that help overall ecosystem to be more robust and more patient centric, I would say.
Also, so we can tell our audience about how Tina helps in increasing their website ranking in the Google. Like, if they will stay more on Tina, if the customers will interact more on Tina, how their website ranking will increase, like how their SEO will work. Can you please elaborate on this part?
Yeah, when we talk about information provision through the TINA, so TINA is like it is a multi-channel integration. So it can be integrated on your website, it can be integrated in the business WhatsApp, or even it can be on the social media platform. So the moment patient landing to that particular platform, uh, apart from the text content, there are a lot of videos are there. So naturally the patient are more interested to know and see that how okay that particular surgery is how is going to be done. So patient can see the, in fact, some of the live surgery video can be integrated on that. And since it is quite relevant to that particular disease, so patient stay for longer time. And the moment they stay for longer time, that also help to improve the the review and rating of the website and other platform. Same time, uh, pre and post services, like Tina send the reminder and notification, so that if you are happy with the services, please rate about services. So this is making huge convenience to the patient to go and rate about the hospitals, or about the individual doctors there. So that way improving the overall digital asset of the hospital.
Definitely, sir. Video content is definitely more engaging as compared to the text content.
Yeah.
So the last question of today's session to you is that how can conversational AI platforms be tailored to address specific challenges faced by healthcare providers?
Yeah, one size fits for all is not relevant in the healthcare, because healthcare practice management is differ from one clinic to another clinic. Single practice versus group of the doctors practice, or corporate hospital versus the government hospital. So in Gravitas we do provide the customized solutions which is relevant to that particular hospital or the clinics. So that makes huge difference. And patient can also get the only relevant information, because many of the information or the services which is not being provided by that particular hospitals, so unnecessary, it is a wastage of time. So uh, this teen or Gravitas provide the customized information, so that patient get the relevant information, come prepared with this information, and talk to the doctors, or the surgeon to under whom he or she is going for the surgery. So it saves a lot of time. And the most important, all this information is a medically approved information, so it's not wastage of time is happening. So surgeon or the consultant utilizing their time quite nicely. Patient has also a lot of, because they are coming with the some of the information, so they can get the quality conversation with the hospitals. So that's make a huge impact in terms of the overall outcome of the either OPD procedure, or the surgical. So customization is the key for the success.
Yes, sir. As in pizza case, also we do the customizations according to us. So Tina also works according to the pizza model only. So we can definitely say Tina works like a pizza model. Whatever the hospitals and the businesses will require, it will work according to that. So anything else
Correctly.
you want to add into this? Yeah.
With this pizza model, I can correlate with the live cases, because like pizza, you have a different choices to
Yeah.
pick up there. Similarly, in the
Yes.
surgical procedure, particularly, you have a different choices depend upon
Yes.
what kind of surgery you are opted for. Okay, like whether it is a robotic surgery or it is a manual surgery. And so that one treatment can be done in 2 3 different way. So patient depend upon their affordability, depend upon the insurance coverage, they can some sort of like menu card they can search and get a decision about that. So that's help a lot. Patient can get the best of the best treatment that from that particular hospitals.
Thank you, sir. It was pleasure hearing such a valuable feedback from you, sir. With this, sir, I would like to summarize today's session where we discussed about revolutionizing healthcare by harnessing tech and AI for better patient experiences. Thank you for joining us, sir.
Thank you, Rosali. Thank you very much. Have a
Thank
nice.
you. Thank you for all our audience. Stay tuned for upcoming interesting live sessions. Thank you.